this function? Well, it forms on rhodopsin. There are certain other compounds formed in between. For example, there is pre-lumi rhodopsin, lumino rhodopsin, meta rhodopsin, one meta rhodopsin, two, and so on, leading to all trans retinol and then all trans retinol. These are breakdown products, and the opsin is liberated. Again, these are brought to the cis form, and again there is rhodopsin formed for the new wave of action. This was about night vision. This was about the visual cycle. This is visual cycle. कौन सा वाला? Wald's visual cycle. मैं उसको कहते यार एक कप चाय वाला तो ले नहीं है. Now we are talking about, this was about Wald visual cycle. Now I am going to talk about the epithelial changes in the eye. Let me tell you that meta-rhodopsin stimulates the transducer proteins in the cell, in the rods. This is a rod cell. So the first transducer is stimulated. Transducer is a G protein, G-linked alpha, beta, gamma protein. So GDP linked. GDP is replaced, goes out and is replaced by GTP and is converted into GTP alpha. This transducer is activated. This acts on and stimulates phosphodiesterase enzyme. This one is stimulated. This acts on and destroys cyclic GMP. Is destroyed. Cyclic GMP will reduce the entry of sodium reduced, while the potassium keeps going out. When the potassium goes out, you will get, the result is hyperpolarization. When there is hyperpolarization, the inflow of calcium is also blocked. This is also blocked. When there is blockage, there will be no release of neurotransmitter, that is glutamate release is blocked, and so there is generation of nerve impulse. This is how the rods will act, because it is the meta-rhodopsin over here, meta-rhodopsin acts and stimulates transducer. Transducer acts on, transducer is this, GDP alpha beta gamma. It leaves it, it becomes activated, GTP is activated. GTP is activated, PDE. PDE is activated, leads to depression of GMP. When there is no GMP, sodium will not be able to move in, while the potassium keeps on going out. So it will lead to hyperpolarization. When there is hyperpolarization, intake of calcium is also blocked. And when the intake is blocked, there will be no release of neurotransmitter, which in this case is glutamate, which is inhibitory. When there is glutamate is not there, their nerve impulse is increased. And the impulse goes to the visual cortex, area 17. Area 17 in the occipital lobe. And then you can see the image. So this was all about visual cycle. Now, because the eye contains epithelial component as well, conjunctiva and cornea. So I'll talk about the action of vitamin A on the epithelium of the eye. In the eye, you've got function of vitamin A on the epithelium of the eye. Here the component, I told you, in the blood is retinol binding protein, but when it enters the eye it forms the retinol. So the component is retinol. That is the aldehyde form. But that was involved with visual cycle. This one is involved with visual cycle. This is the visual cycle. But for epithelial function, it will be in the form of retinoic acid. Now it is in the form of retinoic acid, retinoic. It is not retinol. It is in the form of retinoic acid. Hello. What is it wrong? What about that? Hello? Green? What's the name? Thank you.
Welcome, sir.
So this got to deal with epithelium. That is the formation of proteins, that is glycoproteins. This is the epithelial function, and it is the, I told you about retinol, retinoids, these are all called as retinoids, vitamin A. So it has got one antioxidant function, that is retinol, OH. Then retinol, I told you about Wald's visual cycle. This was the third function, that is retinoic acid. Retinoic acid acts upon epithelium, both on the eye as well as general epithelium. So retinoic acid, the epithelium is both in the glycoprotein function, where in the eye as well as general skin, teeth, GIT, respiratory system, urinary system. So this is generalized. It acts on eye, skin, teeth, GIT. And what does it do? The retinol will enter the cell and it will act upon the intranuclear receptors, the DNA. This is the retinol entering over here and attaching to a receptor over here and leading to the formation of messenger RNA. And messenger RNA acts upon endoplasmic reticulum, rough endoplasmic reticulum, ribosomes, and helps in the formation of proteins. So retinoic acid, all the retinols, they can enter through. The retinoic acid acts on intranuclear receptors. Intranuclear receptors act on the intranuclear receptors, increase the formation of messenger RNA and increase the formation of proteins in the maintenance of epithelium. So, if there is a deficiency of skin, there will be xerodermia. That is dryness of the skin, or you can call it as phrenodermia, frog skin. They call it as frog skin. Teeth, animal defective. GIT, similarly you've got problems. Respiratory, again there is disturbance of the epithelium, it's not normal. Again in uric acid, urinary problems will be there. The epithelium will be unhealthy, and it can also lead to sterility. Decrease in the production of sperms in the male. In the eye, again there will be dryness, because if there is no vitamin A, there is little normal glycoproteins are not produced. They are also deficient. There is deficiency of vitamin A. So it is dryness leading to xerophthalmia. Xerophthalmia is again of two types: conjunctival and corneal. Then there would be, if you see the structure of eye, there will be xerophthalmia, then there would be bite-out spots, whitish bite-out spots, then there would be ulcers, then there would be keratoconus, and when it becomes very much weak, there will be perforation, leading to permanent blindness. Leading to permanent blindness. So there will be perforation. Eyeball will be lost. So this was about all about vitamin A. So it is a very essential vitamin. And well, because it has to deal with visual cycle and all the healthy epithelium. Now, its other uses, therapeutic uses, that I would like to tell you. Therapeutic uses are, that is, I told you about the deficiency as well. Well, actually it's used in psoriasis. There is excessive dryness of the skin, symmetrical dryness of the skin, psoriasis. Psoriasis, yeah. And then it is involved in pre-myelocytic leukemia. Pre-myelocytic leukemia. It is given in pre-myelocytic leukemia. And all in the form of all retinoic acid. It's also called as tretinoin. Tretinoin. It is also useful in acne. There it is given in the form of 13 cis retinoic acid. This one is called as tretinoin. So these are a couple of uses of vitamin A. Now in excess, if it is given in excess, for example, seen in shipwrecks, so that is called, the condition is called hypervitaminosis A. Why? Because in shipwrecks they eat fish liver oils, fish liver and polar bear liver. Polar bear liver. The polar bear doesn't eat them, they will eat the polar bear liver, and so there is excess of vitamin A. Excess of vitamin A leads to alopecia, Kanjapan. Alopecia, loss of hair, plus hepatomegaly, and maybe even death. So this is the condition called as hypervitaminosis A. So what I've talked about is retinoids comprising of retinol, then its combination with fats, lipids, because it is a fat soluble vitamin. You take in fats, lipids, so it goes in. So also remember, when there is difficulty in absorption of lipids, for the person who is not taking fat at all, he will risk deficiency of all the fat soluble vitamins A, D, E, K, and also essential fatty acids. So it's very bad. Small amount of fat must be taken in the diet, because fat soluble vitamins are there, and also fat soluble vitamins A, D, E and K, 4 fat soluble, and also essential fatty acids, L for linoleic and L for linolenic acids, which are involved in the formation of prostaglandins, which are involved in the formation of inflammatory reactions, and leukotrienes, your anti-allergy reactions. So little amount of fat is essentially to be taken. Right. And also I told you about the deficiency, about the normal behavior, the normal working and the deficiency, and also excess when shipwrecks. A lot of fatty liver or fish liver is taken, for example, in shipwrecks, and in the survival, they suffer from alopecia. Alopecia of different types. One is alopecia areata, small area of absence of hair, alopecia areata. Then alopecia totalis, all the hair, eyebrows gone. It's like a globe. And then there is the alopecia universalis. All the hair of the body are gone. And again you may have hepatomegaly leading to severe cases and death, fatality. So that was all about vitamin A. Good. ठीक हो गया? इनमें थोड़ा सा दिखाएं क्या था हुआ है? ठीक